Okay, if we move away from the scapulothoracic joint, we can look at the acromioclavicular joint. And we've got a couple of ligaments that we need to test out here. And those are the bands of the coracoclavicular ligament, the conoid and trapezoid ligaments. Now, the conoid ligament is running more or less vertically from the coracoid process up to the undersurface of the clavicle. And to test this ligament, we will do inferior vertebral border winging. So we'll have the arm either on the patient's side or laying behind them. As I pull the inferior vertebra away, or the inferior scapula away from the thoracic wall, then it's going to tend to push the clavicle in the same direction, downwards. So my stabilization on the clavicle will be to hold it up and back. So that'll be the position there. And I need to come underneath the angle of the scapula and tip it. So if I bring her into this position and then bring the scapula down over my fingers so I can grab the scapula like so, stabilize the clavicle, and then lift the inferior angle of the scapula away from the chest wall. And we're looking for a reproduction of pain around this area, the point of the shoulder, and also an excessive amount of winging. For the trapezoid ligament, we will pull the the vertebral border of the scapula here away from the chest wall. So we'll be tipping it this way. Again, with the arm in basically the same position behind the back or on the side, we will stabilize the clavicle again, and this time grab hold of the edge of the scapula here, stabilize the clavicle, and pull this the vertebral border of the scapula away from the chest wall, looking for signs of instability and pain around this area. We can stability test the AC joint, doing an anterior and a posterior glide at this joint. So if we get the patient in sitting, can you face that away for me, Nora? Like so. We'll come across the posterior edge of the clavicle here, and we can stabilize around the front of the shoulder by putting the heel of the hand onto the coracoid and grasping the humerus. We'll stabilize the shoulder girdle. The thumb will come onto the posterior edge of the clavicle and we'll shear the clavicle directly forward. Now, the plane of the joint is anterolateral, so to test the stability of the joint, it's a straight anterior glide, and for posterior stability, we'll simply shift grips and push it back like so. We can test the arthrokinematics of this joint, the glides, in much the same way. We don't really have to change our position very much, just the direction of the glide. So to test mobility, I shall glide it in the plane of the joint, anterolateral, like so, and posteromedial, like so, pushing through my right hand. There. There is some rotation available here. This joint degenerating fairly early in life, it allows some long axial spin of the clavicle. And we can test this by doing protraction, elevation, retraction, depression of the shoulder girdle. Can you lie on your side, face me? So we're going to come back into the same position as we tested the scapulothoracic joint. Come a little closer to me. That's great. Into this position here, and in order to test the anterior roll of the clavicle, I'll bring Nora's shoulder up into elevation and protraction, and then grasp the top of the clavicle so that as I pull this forward, it will rotate it anteriorly. So there's the test. At the end of the range, we'll stabilize the scapula and just roll the clavicle forward in the scapula. To test the posterior roll of the clavicle, we'll take the shoulder girdle back into elevation and depression, like so, and then apply a posterior roll of the clavicle on the stabilized scapula. So I'm doing this with it. Okay, and grossly what it looks like if I move the whole scapula up and down, and you can see this in this position. So we'll be moving from retraction to protraction. Okay, there's the movement of the scapula, and it's just that at the ends of range we emphasize the roll, looking for the end fill, and the posterior roll here, looking for the end fill. So we've looked at the mobility and stress testing of the acromioclavicular joint. In order to treat this, we can do it in much the same way. If we find that the rolls of the clavicle are restricted, then we can take it into the position that was restricted, much as we did in testing. So for an anterior roll, we'll bring the scapula up and protract it. And this time, instead of simply testing, we'll take the clavicle this way, get firm stabilization on the scapula, and then pull it forwards like so. And we can use a hold relax technique again to get it to the end range, oscillate it, or a prolonged stretch. For posterior roll, we'll take it back into retraction and depression, come on top of the clavicle here, and glide the clavicle backwards, having done hold relax and so forth. If it's the arthrokinematic that is hypomobile, we can treat that as well directly. To produce an anterior glide of the clavicle, one of the better positions is to have the patient lying on their stomach. Come over this way. And if I was to treat the right shoulder, then I will stand on the left side. If I was going to treat the left shoulder, I'd stand on the right side. And bring the arm up into this position, and then bring your thumb onto the back of the clavicle, like so. And then reinforce it either with the other thumb or the heel of your hand. And now, because I'm standing behind and on the other side of her, the glide would automatically be anterolateral in the right direction. Now, most patients, this will stabilize, this arm position will stabilize the shoulder girdle sufficiently so that you can get a good, stable mobilization. In Nora's case, the humerus is too mobile. So what I would need to do there is slide in a sandbag underneath the coracoid and the humerus there, and that makes a much more stable base for the mobilization to occur. But in most patients, you won't have to do that. For the posteromedial glide, we can do that in the testing position, that is up in sitting. Face away from me again. Come down a little bit this way for me. Thanks. I'm getting too old to move up and down the bed, so I have the patients move for me. Stabilize the scapula and come onto the anterior edge of the clavicle and push. I'm going to be pushing the clavicle back and medially. So with it stabilized, it's that movement, like so. And these glides are so small that you really don't have to worry too much about getting to the end of range with these. We've looked at testing and treatment for hypomobility. Unfortunately, most of the problems arise with instability. And here you're going to have to take up different taping techniques for the acute joints and also a sling, and then treat with modalities to reduce the inflammation. But for a stiff AC joint, these techniques are among the easier ones to do.